Have to now cross to Port-Harcourt, where CNBC Africa's Onyi Sunday is standing by for the latest on the Ebola outbreak in that part of Nigeria. Onyi, thank you very much for joining us. What is the latest?
Well, Wale, someone else has tested positive to the Ebola virus, and that's an elderly woman. She shared a room with the late Dr. Ike Enemwa while he was sick in the hospital before he died. And also the sister of late Dr. Ike Enemwa, who traveled to Abia State, who was also identified as a contact and was supposed to be in River State, but traveled to Abia State, has been, they found her in Abia State and she's been sent back to Port-Harcourt. She's also symptomatic and has been sent to the quarantine center. But before she joined them, they had 3 cases there at the quarantine center, the quarantine and treatment center in River State. 2 tested negative and were discharged, but the Honorable Commissioner for Health in the state says that they're going to keep testing them because they're still within the 21 days. So we have just the patient who's tested positive and Dr. Ike's sister who just got called back from Abia State. Right.
Onyi, I imagine this is something that must be giving people in Port-Harcourt a lot of concern. Do you get the sense that this issue is being contained, or right now people are just waiting to hear more news because you have just confirmed another case here?
Well, the thing is, the state is doing all they can at the moment to contain it. But you must also remember that with the interview with the governor, he did mention that the state discovered they had a patient with Ebola after 3 weeks. So you must understand that this, the virus wasn't attended to or contained immediately happened. It was after 3 weeks they found out, and that was after Dr. Ike had passed on. That was when the state realized it was a case of Ebola. So at the moment, it's all about tracing these people, trying to restrict them, and hoping that they'd be honest enough to step out, to step forward, when they become symptomatic. That's all the state can hope for at the moment. At the moment, they have been working closely with the SSS. They're working also with other health organizations to track and trace certain individuals. But right now, all medical institutions are hoping that people give the correct name, give the correct address, so they can actually track them and follow them up.
All right. Oh, yeah. I imagine this is impacting the lives of people that live in Port-Harcourt right now. We know it's the oil capital of Nigeria. Is this having any impact on business at this point?
Well, not really. No, it isn't. Well, it will surprise you to know that at the moment, most journalists are calling for the state. It's pretty funny because it behoves on the media actually to send the message across. Many people are still in the dark about Ebola, its mode of transmission. So you really won't get a sense of panic all around at the moment. People are going about their daily activities, and also to show you how aware people are becoming. Of course, hand sanitizers are being sold out at the moment, but those who are also asking people to take a proper look at the hand sanitizers they're buying, because they have lots of fakes in the supermarkets now, and also they also need to look out for the alcohol level in the hand sanitizers they are buying. But at the moment, panic really hasn't taken over the state. It's all about creating awareness at the moment. It's business as usual in most parts of the state.
All right, Onyi, thank you very much for that update. Onyi Sunday, CNBC Africa Onyi Sunday, reaching us from Port-Harcourt, giving us the update on the outbreak of Ebola in that part of the country, confirming another case of Ebola in Port-Harcourt.